My name is Matthew Thomas, and I'm here to discuss the obesity crisis of Nauru. Some backup information. In terms of its size and population, Nauru is one of the smallest nations in the world. After their independence in 1968, Nauru had some of the most wealth per capita. That wealth came at the cost of environmental destruction as colonizers exploited the land to mine phosphate. When they ran out of phosphate, Nauru's economy collapsed, making them reliant on imported food and foreign aid. How did that happen? Due to a decline in traditional agriculture, imported goods high in sugar, sodium, and fat ended up becoming commonplace. Some of the food that became common include soda, canned meats, ramen, rice. Modern work environments, as well as technology, especially with the rise of social media and phones and tablets, have led people to become more sedentary, especially as people, sitting down in their office for like 8 hours a day. People start driving cars and thus, don't necessarily walk as much, they don't necessarily bike as much, they're not gonna, move as much because the impact of this, as of today, is that more than 90% of the Nauru adults happen to be overweight. And over 70% of them are actually obese. These are some very alarming numbers as a result of this overweight, because they're more overweight because of this high level of sugar. 40% of the 9,000 citizens of Nauru have been diagnosed with type 2 diabetes, according to the World Health Organization. Furthermore, heart and kidney failure has also been effects of some of this unhealthy eating and lack of exercise. And because of the lack of necessity in terms of infrastructure, many people have had to go out of the country to receive care. And now, going to the cultural and societal aspects, according to the National Library of Medicine, obesity can often be seen, or at least used to be seen, as an indicator of wealth and prestige. Younger generations being exposed to fast food places, leading to a disconnect from traditional and healthy eating. And now let's go into the solutions and actions that we can take to, rectify some of the health disadvantages of eating all these unhealthy foods. And that includes national health campaigns. To combat the rise of obesity, the Nauru Ministry of Health has launched an effort to educate on the importance of healthy eating and physical exercise. As part of this mission, they have released guidelines on nutritionally rich school meals and regulations surrounding taco shops. Schools are now required to teach nutritional science and may actually ban junk food. Another factor that has helped us in terms of rectifying this issue is the reintroduction of traditional foods. The quote-unquote "Let's Go Local" movement gives guidance onto healthy eating, primarily encouraging the eating of foods such as taro, coconut, and pandanus. The reason why these foods are being encouraged is that a lot of these foods contain nutrients such as fiber, manganese, potassium, vitamin C, vitamin B12, and other nutrients that are known to cause improved digestive health, stabilize blood sugar, improve blood sugar levels, improved vision, healthier skin, better circulation through blood, and improved immune system function. Therefore, you're less likely to get sick. As a result, community gardens and local farms have been starting to become commonplace again. And now, let's go into international support. The World Health Organization has been working in tandem with the Nauru Ministry of Health and Medical Services to tackle the obesity crisis and other services. An outcome of this plan is the National Strategic Plan for NCD Prevention and Control. This outlines policies promoting healthy eating habits, exercise, walking, getting adequate sunlight, trying to get enough food, that kind of thing. Other partners include Australia's Department of Foreign Affairs and Trade in New Zealand with their aid program helping to provide the necessary infrastructure. Another one I forgot to mention, well, it's actually shown on this presentation, is Doctors Without Borders, which is an organization dedicated to helping assisting people across, across nations and stuff to ensure that they have access to proper health care. Why does this matter? Well, NER's obesity crisis symbolizes a much greater issue: how colonization and globalization disrupts traditional social and cultural norms. The efforts that we put into trying to bring into this public health is about bringing balance back into culture, healthcare, economics, and people's self-worth. Okay, if we're able to exercise, well, less likely to rely on healthcare system. We reduce strain on our healthcare system. If we exercise better and we are more healthier, we are more likely to work harder and thus provide a better economy. If we're healthier, we have a better self-esteem, therefore improving our way of life. Moving to grow locally, to cook traditionally, and to increase physical productivity are all part of an effort to reclaim control over our health. And as you can tell, we have an image right here saying food is medicine, food is nourishment, food is culture, food is pleasure, food is community, food is nutrition, food is connection, celebration, nostalgic, comforting, vitality. Why do we say that? Because food has a lot of antioxidants inside of it. Food can have many cancer properties that can prevent cancer, it can prevent heart disease, that can help with COVID-19, as with like vitamin D, for example. It nourishes the body, it cleans the body up. It's culturally, some cultures have distinct foods that, one culture to another. Nor with the coconut, with the char, that being the mainline de facto meals. Food is pleasure, we all enjoy food. It's community, it helps us bring us together. We have meals, we have kitchens, steakhouses, etc., etc. And in summary, now, obesity crisis is not just a matter of food, it's a product of the effects of environmental destruction, economic collapse, and cultural displacement. But Neurons are not passive victims. With national action, local activism, and global solidarity, they are fighting back against this health emergency and reclaiming their right to a healthier future. Thank you for viewing my presentation.